Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show, bringing another really fascinating guest today involved in creating a better tomorrow for all of us. Today, we have the honor of being joined by Dr. David Agus, a renowned physician, cancer researcher, author, who currently serves as a professor of medicine and engineering at USC Keck School of Medicine and Viterbi School of Engineering, as well as the founding director and chief executive officer of the Ellison Institute of Technology. And there he leads their pioneering research in personalized healthcare, developing and leveraging various technologies like AI to ultimately help doctors make better healthcare decisions tailored to individual personalized needs. Dr. Agus is also the founder of several personalized medicine and health and well-being companies, including Navigenics, Applied Proteomics, as well as Sensei and Sensei Agriculture, which we'll be getting into a bit today. As a global leader, he advises organizations like the World Economic Forum, the Global Health Security Consortium. He's a CBS News contributor, and he has several best-selling books, including one which we'll be getting into today, the Book of Animal Secrets, Nature's Lessons for a Long and Happy Life. Dr. Agus graduated cum laude in molecular biology from Princeton, went on to do his medical degree down the street here at Penn Perelman School of Medicine, and completed his residency at Johns Hopkins, as well as an oncology fellowship at the Memorial Sloan Kettering Cancer Center. A lot to get into today. Honored to have him with us. Dr. David Agus, thank you so much for taking the time to go on the show.
All right, it's a pleasure to be here with you.
Great having you. A lot to get into. Would love to start off about 35 years ago. I took a look back at, a lot of the work that you did in the early days back at Penn, at Sloan Kettering. And, a lot has happened since sort of the early days of the xenograft models you were doing and prostate cancer and epithelial cell cancers into sort of the current very complex era of oncogenomic, oncoproteomic profiling of tumors, microenvironment dynamics, and so forth. Reflect back for us a little bit on sort of this amazing evolution that you've seen, as well as been a major part of ushering in on the oncology front.
It really is amazing. When I went into oncology, I still remember it. I was at Hopkins training in medicine. And, you have to make a choice in internal medicine residency. I want to go into cardiology, pulmonary oncology. And I went to my head of medicine and I said, I'm going to go into medical oncology. You have this kind of meeting where you say your future. And he looked at me and goes, David, you're smart. Why would you do that? It's just giving poisons to people. Chemotherapy literally is poison. There's no academics or thinking there. I was the first person in history to have gone from Hopkins to Sloan Kettering. And he said, you're smart. Go into cardiology, go in pulmonary where you can make a difference. Why go into kind of a dead-end field? And it's interesting. It doubled my resolve. I wanted to go where people weren't. And I'm a kind of a control freak. You can ask my family. And so I didn't want to be a consultant where a doctor sends me, well, add the Lipitor, change this. I wanted to be in charge, and oncology enables you to do that. And it's a place where you could take something from the lab and give it right to the patient. I was lucky, it's all your training. It's all who your mentors were. I trained with some of the greats, Bill Paul in immunology at NIH, David Goldie in oncology, really amazing, amazing people. And they taught me a lot. And one of the things they pushed was, go to the source. Look, doing research is one thing, seeing patients is another, but the hybrid is really unique, and take advantage of that. So I started something back then, which I still do today, which is I do autopsies on the patients of mine who unfortunately pass away from disease. And I get to see what's inside, what's going on. I thought that was scar tissue, and it really was cancer in a thin layer. They were short of breath. Well, they had a blood clot that I couldn't see on scans and I missed. And that's how you iterate and learn better. So everything I do in cancer research, even onto the AI now and the molecular stuff now, the foundation is I get to see and smell disease.
Right.
People today, I mean, the way they understand disease is they use a device. They Google something and they forget that hands-on nature of it. And I think there's a power to that. I trained at Hopkins where William Osler wrote the first textbook of medicine at the turn of the century. And Rockefeller's priest read it on a train and was so impressed with the writing and the description of disease because they didn't have drugs. And so it was basically a description of the disease beginning to medical, middle, and end, that he convinced Rockefeller to go into medical philanthropy. And it started to really change things. And so being able to see and smell disease, which, Osler saw patients at the bedside before doctors just told people what to do. That was a novel thing. And it really impressed upon me that where I can make a difference is that translation of seeing the patients, which I saw yesterday, the day before patients, I see on a regular basis with the lab and put the two together. And that's unique, unfortunately, in today's world.
And continuing along that line, I mean, the Ellison Institute of Technology, obviously named after Larry Ellison of Oracle fame, has a quite broad purview. I mean, you obviously focused on health and medical science, but you have things going on food security, sustainable agriculture, climate change, and you have a bunch of innovation labs where a lot of some of the things we're just talking about, sort of the oncology fund, are broken down here, but obviously have application far beyond that in terms of, an AI lab, a microenvironment lab, molecular analytics, and so forth. Talk a little bit just about the history of the organization. I mean, I know there was a couple iterations beforehand. There was something that known as the Ellison Medical Foundation, which was primarily focused on aging and infectious diseases, and then an Ellison Institute for Transformative Medicine. Talk a little about how this all feeds together and sort of the genesis of it all.
I mean, I was a trainee at Sloan Kettering, and I went on to become faculty at Sloan Kettering, and it was one of my great privileges to work there. It's a remarkable place. I mean, volume of patients equals quality over time, and I learned a tremendous amount. And a couple of people came to me, Andy Grove, who was chairman of Intel at the time, and Michael
Sure.
Milken and Steven Spielberg, and they really pushed us to come out west. And Andy said, "Hey, listen, on the East Coast, they keep hitting singles. On the West Coast, you swing for the fences. If you strike out, you start again, but you at least have to swing for the fences. There's very much a hierarchy. On the East Coast, you work your way up. On the West Coast, it's a meritocracy. I mean, whoever is good gets the resources." So we came out west with our family, and it was one of the greatest things I've ever done because it's a whole new way of thinking. And I was privileged to work with a lot of the tech pioneers, and I learned from them, really how you risk everything, because that's our job, is to take risk. Much of science is incremental. I
Mhm.
want to do this experiment so I can get the grant and show the data to enable me to do the next experiment, the next one. I just want to swing for the fences now because I have the privilege, or you could say it's the opposite, but I look at people who are suffering from cancer on a daily basis. And I realize that the quicker I do something, the more I swing for the fences, the more impact I can make. And that's what I have to do. NIH is amazing, and they fund this remarkable incremental basic science. I want to do these crazy things that they won't fund. So we're obligated to be out of the box. So the Institute, came about with Larry. And, I was at USC as a professor of medicine and engineering and doing fine. And we sat there and he goes, "What's your dream?" I said, "My dream is to have a place where I can have engineers, mathematicians, physicists, people who look at the same thing I look at with a different lens. They're basically trained differently. Their brains are wired differently. So if you have the diversity of thought looking at the same problem, the same data, you're going to get new insights." And he goes, "Well, how much would it cost to put together such an institute?" I made up a number on the spot, literally. What do I know? And he goes, "Great, let's do it." And we did it. And it started off with this building. It's under construction. We bought it, and then we changed it to be a place where everything can integrate. And something, every wall is glass. So when patients come in, they see researchers working, and that's hope personified.
Right.
And researchers see the patients suffering from a disease, and they go, "I got to double down my efforts." So it turned out to be fantastic in that regard. And it was novel, right? Most places, there's the biology building, the chemistry building. the cancer building, the lung building. Here, we just integrated it all together. And I think that integration was something really unique. I got it from Andy Grove. When Andy did Intel, he did something that was crazy in that he basically on every floor would alternate marketing, sales, research, development, and he wouldn't have departments. He would just mix everybody together. So when they got coffee, they would talk, hey, what's the problem in sales? What are customers wanting? And the R&D people, maybe I should change something. And it was kind of wild to model designing a medical institute based on Intel. And then, we started to do well. And then the technology revolution really happened. I mean, this is a technology revolution. I'm old and I've been here for a lot of decades doing this. What's happened in the last 18 months, you know, dwarfs everything that's happened the decades before, is that AI is enabling us to go leaps and bounds. And we started to see that we can make an impact, not just in the straight medical stuff, but the technology we have, the thinking we have, can potentially help other areas. Obviously, food is tremendously important to humans, and it's our input function, if you will. So, how can we help food and food security and food related to health? And that's where Sensei Ag came from, and we could
Hmm.
talk more about that.
Cool.
The AI groups we're working with now, we could design drugs in months rather than decades,
Right.
and it becomes game changing. We could take healthcare data, which were bags of words, your electronic health record. When you go to your doc, he or she types in a bunch of words, and we can now convert that to structured data and analyze that and find insight we never knew before. So it really is this amazing time. And luckily, we're at a place and we have the infrastructure, if you will, to make impact with it.
Excellent, excellent. And it's so interesting because, despite the amazing explosion of these technologies, as you were mentioning in recent months, in the last year and so forth, in the new book, you go into the evolutionary past, in some cases, hundreds of millions, if not a billion years, to a lot of these, secrets that are still sort of locked up in nature. I've always been personally intrigued by just the history of what nature has given, say, the current pharmaceutical industry, from penicillin to aspirin to streptokinase, on through to, of course, the current GLP-1 products, making trillions of dollars, which come originally from Gila monster venoms. You go much deeper in the book, well beyond sort of just the secondary metabolites that nature produces for us. Why did you write this book? Talk a little bit about it.
You know, I get up early in the morning, and one of the things I love is to be able to read and write. And so I went on with my family to a trip to Africa, which, by the way, is the freaking coolest trip in the world, right? You're there seeing the way the Earth was before we made the metropolises we have today in the United States. And it was kind of wild. And I'm with the guide, and an elephant walks by. And this elephant is, 50 to 100 times bigger than you or I,
Right.
50 to 100 times more cell. And I say what every logical biologist would say is, with so many cells and being exposed to UV sunlight every day, there must be gobs of cancers in these animals. He looks at me and goes, elephants never get cancer.
Mm.
And how can that be? And I started to look into it. A group in Arizona had done some amazing work showing that elephants have a gene, P53, that you and I have, the guardian of the genome. We have
Mhm.
8 copy, they have 20 copies of this gene. So all of a sudden, here's a way where they can correct errors in DNA that potentially, if we can recapitulate, we can prevent more cancer. What other lessons can we learn? And so I started to set up these Zoom appointments. This was when Zoom was starting to take off. It's hard to imagine that, this is second nature to us now, but several years ago it was novel. And I made Zoom appointments. I just sent these emails to the world's ant expert, to Jane Goodall and Big Apes. To, you go through the list of them, and all of a sudden, I would have these conversations and I would say, here are the hallmarks of cancer: heart disease, Alzheimer's, longevity. What can we learn from the ant, from the giraffe,
Mhm.
and go through the animals? And the answers were amazing. And so we've all been on this earth for long periods of time, all of these creatures. We've all adapted to similar conditions. What can we learn from these amazing creatures and natures that could affect human health? And then cool is work backwards and look on the biology of it, but
Right.
start forwards from these observations, because sometimes the answers are staring us in the face.
Yeah, I enjoyed, a couple of years ago in Lancet Oncology, you wrote this piece on, it was entitled Future Cancer Research Priorities in the U.S. And, it sort of outlined the Blue Ribbon panel report from 2016. And in this, you outline these 10 major recommendations, some which we've been doing pretty good on in terms of cancer immunotherapies and novel targets for drug resistance. Others, as you were talking about prevention, maybe not so much, but we're sort of getting there. And, bring up, topics like immunological prevention, immunointerception, and these concepts of, can we move the immunotherapy concept a little earlier in the chain, and the elephants sort of give us interesting clues, as you were mentioning, per the ability of having a lot of p53. Not that we could genetically engineer super p53 people, but nonetheless give us the important clues. Another really interesting piece, just on sort of the cancer angle, which I found fascinating. This is later on in the book. You talk about a dinner that you had with Nobel Prize winner Shinya Yamanaka of Yamanaka factor fame, which we've talked a lot about on the show. And one of the things you mentioned in your conversation is that as useful as these Yamanaka factors are in terms of regeneration and so forth, they can teach us a lot about cancer. And we compare sort of wounds and how wounds know to stop growing and grow in a certain area and, fall off at some point. May also teach us some really interesting things about how we may one day learn to convert cancer into something else and maybe not just kill it. Say a few words about that. I just thought it was, again, it's a fascinating book, but to see you talking with recent Nobel Prize winner about this really hot area in bioscience nowadays, I thought was pretty cool as well.
He's an amazing guy. And
Yeah,
so we were actually in Kyoto having dinner. And, we basically look at the same nexus in biology just from different angles.
right.
His job and his goal is to get these stem cells that are quiescent in all of us when we turn 25. Our stem cells kind of go to sleep.
Yeah,
His goal is to turn them back on. And he's doing tries now in the eye. He's doing some things in the brain that are just amazing to reactivate these quiescent stem cells. One of the problems in cancer is that, our stem cells keep going. Cancers have stem cells and they keep going. So many of the treatments that we've developed really hit the differentiated cell,
yep,
the cancer cell, and the stem cells are still there. And so my goal in cancer is to actually stop that. So, the analogous thing in normal biology is a wound. If I or I push you off a bicycle, not that I would, but if I push you off a bicycle and you skin your elbow, your platelets come in and they secrete factors to stop the bleeding. And then they also reactivate stem cells and your wound grow. That wound is a cancer. It grows, it overgrows the wound. That scab is higher up in the wound. And all of a sudden it stops and involutes back and you'll end up with normal skin. So that stop signal, if I can identify it, I can help treat cancer dramatically and reduce suffering. Shinya wants to make the go signal. I want the stop signal.
yeah.
So it's kind of interesting with his model systems. What can I learn to get that stop signal that he's been ignoring and we're pining for? It's kind of an interesting synergy between us.
Yeah, I wish I was a fly on the wall just listening to that discussion, but yeah, it was a pretty cool thing to run into in the book.
By the way, one of
Uh,
the prettiest cities in the world. I mean,
yeah,
Kyoto is amazing. Where Zen Buddhism was discovered, if you will, the
yeah.
temples, the gardens, every detail. We were in a garden together walking, Shinya and I, and the gardener was there. And he said, this garden will be perfect in about 300 more years. Can you imagine making a garden so that you're planning it so that in 300 years it's perfect?
Yeah, yeah, amazing. As I mentioned in your bio, another one of your major initiatives is known as the Global Health Security Consortium. This is a partnership between your organization at the Ellison Institute, Oxford, and the Tony Blair Institute for Global Change. And you've created this one-shot initiative, Making Preventable Disease History, which is focused on a lot of the viral disorders, as well as our new applications for prophylactic vaccines for things like heart disease, cancers, and so forth. You also, at the Institute, have some very new project called EIT Pathogena, which is specifically focused on Mycobacterium. And there is a little overlap there between these two initiatives. I was wondering if you could talk a little bit about One Shot, a little bit about the Global Health Security Consortium, but then if we could sort of feed into the really cool chapter on sort of the social immunity concept, where you talk about, bats' resilience against viruses, about ant saliva being able, sort of a new source of antibiotics in this area of antimicrobial resistance. Would love to get your perspective on all that.
I mean, listen, it's very not often that you're asked a question that goes from Tony Blair to ant saliva.
Right.
That's pretty unique if you think about it. During COVID, we were privileged to start to work with Tony, former Prime Minister of the UK, and John Bell, who is the Regents Professor, which is the same position William Osler, who I just mentioned, held at University of Oxford.
Mhm.
And, very quickly we saw we each brought something different to the table. There was remarkable synergy when we were together and how we approached things. Tony could approach any head of state. John had at his fingertips all the global health community of Oxford and the EU. And obviously we had a lot of the technology and the ways of analyzing data. So together it was very exciting. And that led to programs involved with COVID-19, some of the vaccine programs, some of the monitoring programs. And then as COVID-19 became no longer an emergency and something we were living with rather than fearful from, we started to say, can we apply those things into other areas? One of the areas that was key was in pathogen surveillance.
Yeah.
So the notion now that there is no data system to collect what's going on with these pathogens. We give a pathogen a name, and then these are dynamic. Over a million years of evolution, the human genome changed 1%. Well, a virus can change 1% in a day.
Yeah.
So by giving a label to something doesn't necessarily tell you what it is, what it's responsive to in terms of treatments. Does it have a particular resistance pattern? Is it changing? Is it of a lineage that started next door? Or is this something different that somebody brought from a different continent? And so in today's world, we can now do DNA sequencing very inexpensively, and we can put it to the cloud into database and do analytics really in real time to be able to say, hey, this is just a continuation of something that's going on. In the United States now, we have a flu that was in cattle and livestock that we're finding in wastewater that people who took care of the cows are saying. And this is a particular kind of flu that has a very high mortality rate. Luckily, COVID had an extremely low mortality rate. This has a very high mortality rate. And so we can get human to human spread, we're in trouble. So we
Right.
need to monitor that. And we're not monitoring that with really molecular surveillance now to understand it. And so we started off by doing it with COVID, and now this program called Pathogenia, it's a funny name, wasn't my choice, but it
Okay.
is looking at various pathogens around the world so that we can start to understand their dynamism and then in the end get better treatment. You don't need to sequence everyone.
Right.
If I sequence Staph aureus in LA at certain representative places, I'll know, hey, everybody should be on this antibiotic or that antibiotic, because obviously the quicker you treat, the better the outcome for the patient. And the cheaper it is, the more efficient it is in the long run. And those are the things we're trying to do there is bring new technology in, bring the analytics in the cloud in, AI in, so we can actually manage infectious disease better. And it's really something that we learned from the cancer space, right? We would
Right.
sequence the DNA of a cancer, we would see how it was changing and dynamic, and we would get targeted treatments. And we were good at that. Other fields were somewhat much more slow to adopt it. At the same time, we are a country that during COVID, all of our policy decisions were made on a small Middle Eastern country of 6 million people, which was Israel. So we had no data here in the United States.
Yep.
We used their data to make our decisions. In the United States, every state collects their own data, and it could be in any format. It does not have to be given to the federal government. During this recent swine flu outbreaks, many of the ranchers just say, screw it. I don't want you to collect any data from us. And they were allowed to. And so we need to figure out ways how there's one stripe of data for the country. Why is there the Mayo Clinic data set, the Harvard data set? There should be the US data set.
Yeah.
Start to look and understand what's going on, share data, and use that data to improve humanity. In today's world, we can privacy protect data and at the same time use it to benefit others. And that's what's key. Your doctor doesn't own your data. Your hospital doesn't own your data. You as an individual own your data, and you should have a right to be able to have that data used to benefit yourself and others, because this is what's going on now. So a
Mhm.
study came out of the UK. It was crazy. They took electronic health records, converted it to structured data, and showed that people who had the shingles vaccine, right? Shingles is a recurrence of chickenpox,
Sure.
had significantly lower cognitive decline in Alzheimer's disease, so they got older. That was amazing that Alzheimer's may be a response to a virus. For whatever genetic herited reason, you make plaques when you have some inflammation in your neurons, and some don't. Those are the ones who do go on to develop Alzheimer's. That was an astounding finding that we missed with biology over decades. Now AI is giving biology new directions to work in.
Mhm. And you just reminded me I have to get the second shingle shot, but thank you.
It ain't
Or-
fun. Believe
yeah,
me, it ain't fun. I remember
yeah,
my second shingle
that
shot.
was rough. The first one
Tylenol,
was rough.
hell of a medicine that worked. But yes,
Yeah. Well, awesome. David, let's talk about Sensei and Sensei Farms because when I first looked at this, I thought, okay, this is sort of concierge medicine, but this really goes far beyond typical concierge services here. I mean, you're really combining. I mean, the tagline is well-being guided by knowledge, but you're really combining a lot of sort of the data-driven approaches and science that we've been talking about with what I'll call sort of the ecological determinants of health. I mean, if I hang out in Hawaii, I probably feel a lot better than I feel now sitting in Philly. But talk a little bit about this one because I know this is also with Larry Ellison, and say a few words about what Sensei Farms is all about. Because here, this is not just nice, good food, but it's you have a United Nations Sustainable Development Goal part of this, which is important in terms of the triple bottom. Talk about
so
that as well.
Sensei was just fun. I mean, one of my closest friends owns one of the Hawaiian islands, which is pretty cool to say.
Yep.
And he has a resort there. He says, listen, you've written books on health. Let's just make one of the resorts a wellness retreat. So it's not concierge medicine. I don't like concierge medicine because I think quality comes from volume. I see a very high number of cancer patients. That's how I get good. So concierge implies a very small number, and I'm not really a fan of that. And I think healthcare should be accessible to all, so I don't like the entrance fees. But what Sensei was is it took a resort and we said, hey, listen, let's apply the principles and have people who can educate on food, on healthy living, on exercise in a very data-driven fashion. Not pushing supplements and things that have no data, but really just
Right.
pushing data-driven things. So we do things like when you go for a massage, we take whole body thermography, which looks at small temperature gradients across your entire body, and we can see where there's increased blood flow, where there's inflammation. And the masseuse targets there. First of all, we know if the masseuse is any good. And that information goes to the yoga person, and they know about you and can actually, in a data-driven way, start to help you. And so we have one in Hawaii. We roll one out in Palm Springs area of California, and we'll have several more rolling out. And that's somewhere where you can go for a day, 3 days, 5 days a week, and have people educate you about data-driven health in a very relaxed and beautiful. Larry is one of the greatest designers, both landscape and interior, that you can imagine. So it's his aesthetic, which is through the roof. And that was a fun project that we work on together. It's not anything that either of us take profits off the table on, but it's something that really we believe in. And this is a way to get it out to larger groups and then figuring out ways to scale it for the masses.
Hmm.
And, he had an island that was amazing. This is a history on Lanai, which is one of the five Hawaiian islands,
Right.
where at one point it was 90+% of the pineapples in the world were grown on this island by Dole.
Mm.
And
Okay.
water was a commodity on the island. So they would actually cover the entire island in black plastic to keep the water in so it wouldn't evaporate. And because pineapples are big and hard to transport, they would spray it with a chemical that would force mature the pineapples. So they were all matured at once. So it can go on one big barge and taken to the mainland to be sold. So the island, in a sense, was contaminated with some chemicals and the black plastic. And so it was this weird paradox that you couldn't grow things there in a really safe, sustainable, large scale way because of that. So we started to delve into the field of greenhouses, really as a project for the island.
Right.
And then we realized that greenhouses were optimized for literally tulips in Holland, and they go
Hmm.
back, a long way, but they weren't optimized for today's world in a sense. So could we bring in technology and some of the great engineers and redesign them? They were made of glass. Well, glass filters out light. What a greenhouse job is to convert light to food. So if you're filtering out 30-40% of usable light, that's not a good thing. So can we develop a polymer, if you will, that didn't absorb light? Can we heat and cool the plants? Because, they're enormous facilities. To heat and cool them was crazy amounts of energy, which made it really expensive. Can we figure out ways with solar, Tesla, and different ways of heating the plants and doing it to make it much more efficient? Can we figure out a way, because they're optimized for both humans and plants to be there? Well, that doesn't make a lot of sense when we require different conditions than the plant. Can they be optimized just for the plant? So robotics can do it, so we can have a better yield. Can we use machine vision to know what's inside the plant in a non-destructive way compared to mass spec data and change the conditions, the nitrogen, the temperature, the water, to be able to optimize for things that are good for human health? And the answer to all of these was yes. We brought in some of the greatest engineers in the country, literally, and we're making these that can fit into a container, be shipped anywhere in the world, that can make food for the human condition. So that means developing them for sub-Saharan Africa. That means for developing them from the northern United States to the southern United States and making this food. If you look at a Walmart, the largest purveyor of produce in the United States right now, they lose 40+% of their produce to wastage. It sat on a shelf too long, was too hard to transport. It came from a different country, and so it was a week in getting there. But the beauty of indoor growing is we can harvest every single day. Can we do it so it fits within the supply chain there, and we could do food that is optimized not just on how much we can grow, but how well we can grow? And so I think you'll see over the next year or so some things roll out there that are really, really exciting, again, to help humanity. And that's where EIT, Ellison Technology Change, is. We want to choose big problems that help humanity. And all of the analytics that we did for proteomics in the blood, we're doing, for tomatoes, for lettuce. It's kind of neat to see the
Yeah.
intersection of these amazing technologies that were developed for human need of cancer, for example, and
Yep.
now applying it to food. If I give you a tomato, I want to optimize it not just on how it tastes, but so that insulin spike or the glucose spike you have after eating it, it's very slow. So make sure the fiber is good so that you get a slow absorption rather than this crazy peak, which isn't good for health in the long run.
Well, while we're on that topic, let's jump back to the book and talk a little bit about chimps because you do this piece on the fact that hey, the chimpanzees interestingly have pretty decent cancer resistance and dementia resistance, but they get this condition known as myocardial fibrosis. And it's funny because a couple careers ago I was involved in a gorilla project and they were getting something known as fibrosing cardiomyopathy, which I guess is somewhat similar, but in that particular study, it was sort of finding what the gorilla wasn't getting in the zoo versus what it was getting in West Africa in nature. I think with the chimp, it was a little different about you giving too much of certain things. What are you learning in terms of sort of I don't know, call it nutrigenomics, evolutionary diet, things of this nature? Because I think it's an interesting piece of the book, but also sort of feeds into what you're talking about and how ultimately we can personalize some of this stuff, like personalizing medicine, but in terms of diet.
It's very interesting. I mean, the chimps are a great example, is that, you know, there are two seasons the chimps live in, the wet season and the dry season. And in the dry season, they literally are vegetarians. They eat things on trees. And the reason is that for them to hunt a monkey, which is what they would eat, is a lot of energy. And only 30 or so percent of the hunts are successful. So if they had a hunt or two and it wasn't successful, they can die in the dry season. In the wet season, there's plenty of food, so it's okay to have a failed hunt. And when they get that hunt and you see they eat the fat and the protein of the monkeys, they dramatically improve their performance, both their cognitive function, their athletic performance, their memory, all of those things get better. And so you start to see that, in nature, we were evolved for certain things. Humans evolved to make their kill in the wild and then eat it that night for dinner and then have the leftovers in the morning. First of all, we weren't made to graze, and very few creatures graze, especially performance creatures, right? They eat their meal, and many of the times they're as a group. When they have the kill, they all eat together. It's a family meal in many respects. And the same is true for us. And, really over the last 100 years, we as humans evolved this new thing called a kitchen cabinet where we have plenty of food where we can go anytime and eat whatever we want. Well, that's not how we were designed. And so one of the simple tenets of human health is eat your meals around the same time every day and nothing in between. Same amount of calories, we're fasting in between meals as eating all during the day. You'll lose weight, you'll improve cognitive function and athletic performance. Pretty wild right there. But a lot of this we can kind of learn by mimicking what the animals do and how they do it. Jane Goodall told me that, she tried to go back and eat food that was originally in nature that humans haven't changed in the last 100 years. So they go back and eat things the way they were. And
Mhm.
she said, David, it lasted 3 or 4 days because it's the most palatable stuff you've ever had in your life.
Yeah, yeah,
There's a reason we farm things certain ways, and
right,
it actually tastes much better. Listen, to be a vegan is fantastic, great for the environment, but it's hard on human health unless you really know what you're doing because there's so many carbs in nature. So you need to be able to get enough protein and enough fat at every meal, and that's hard to do. And so you really have to focus on it. So if you know what you're doing, it's amazing. If you don't know what you're doing, it cannot be the smartest thing in the world, which
right.
is kind of wild if you think about it. But yeah, looking at these extremes in nature tell us things. The queen ant, the same genetics as the worker ants. That queen ant lives 40, 42 years on average.
Yep.
The worker ant lives 6 months. What's the difference in behavior, in risk taking between them? It's kind of the coolest thing in the world. Do you know how they identify who the worker ant is? They file for behavior. It takes about a week
Right.
to identify the worker ant versus the queen ant. Now, do you know how they mark the queen ant for the rest of her life?
No, how?
Only people who are older will realize this. There's something called whiteout. You know how you
Yeah,
use
yeah, yeah.
whiteout on like your type things and then
Yep.
you type over it? They use whiteout on the back of the queen ant, and that's how they identify who she is.
Hysterical.
My kids
Hysterical.
wouldn't know what whiteout was.
No, neither would mine. That's an awesome story. Um, dude, let's transition now to some of the more dramatic, I'll call sort of superhero capabilities of some of our friends in nature that you bring up in the book. And in one area I'd like to go into is that of aging and longevity. This whole theme of health span has become very popular lately. And there's a lot of companies out there that have been dumping literally, billions of dollars into, we talked about Dr. Yamanaka early on in the discussion, but in sort of utilizing his factors in terms of sort of partially reprogramming our tissues to be younger. As you point out in the book, when you get to the Turritopsis, the immortal jellyfish, it might require a little more than that. I mean, Turritopsis not only turns back its age, but also it's the fate of a lot of its. I mean, turns itself into a little baby again. We don't want to do that. But if I have some fibrotic tissue in my heart, I'd like you to turn that into new muscle tissue. I don't want younger cancer. I want the cancer to turn into something else that it used to be. Talk a little bit about this because I think the whole area of cellular reprogramming is fascinating, but we have a lot that nature still can teach us on how not just the jellyfish but the planarians, the amphibians, and so forth utilize this capability.
Yeah, it's a complex area. I mean, and human nature is try to get reductionist over and
Right.
over, right? I don't know, 20 years ago we said, hey, listen, if I give you growth hormone, if I gave you growth hormone, a few months later, your friends are going to say, "Oh my gosh, you look younger, you look better, you're more muscular, you must be working out," and it works. Unfortunately, in the randomized trials, it took a decade plus off people's lives. Right? Heart gets bigger, you get cardiac arrhythmias and sudden death. Death is a bad outcome for a drug. You get the muscles around the lung get bigger. You can't push out bacteria. You get pneumonias. All kinds of things happen. And so it's very difficult when you look at some of these factors that can, well, it's going to make you younger and turn on your stem cells. That's true. But again, in a complex emergent system, it changes a lot of things. And so I think that's one of the things that we all have to start to be aware of. Nature evolved with some species ways to reactivate stem cells and to do things in a way where they can keep being young and doing well.
Yeah.
Humans, if you think about it, right, evolution selects out for who has good children. It doesn't select out for who lives longer. In fact, living longer is probably bad for a community. You take up food and housing and you don't contribute children back. So it may actually have been something that's programmed within us to actually knock us off from cancer, heart disease, and others. And so, how do we go around that and start to pick? And in engineering, we call it an optimization parameter. What's the optimization parameter?
Yeah.
Well, it's going to be at different scales. It's at the organ scale and then the organism scale. And how do we do it in a way where I can optimize on your heart function, but if I do that and brain function goes down or musculoskeletal function goes down and you break something, then I haven't done a good thing. So how do you optimize on the organism scale? And that's pretty difficult. And so I think looking back to some of these other creatures and how they've done it, what we start to see is, right, the smallest of every creature in general lives longest.
Mm.
So, when you go into a species, it's not that the individual species, the larger, but within elephants, the smaller elephants will live the longest. The smaller, and almost in every creature, the same thing with true with humans, right? In general, the larger the human is, the shorter the lifespan. So that's a potential lesson there, and understand that.
Yeah.
Murray Gell-Mann was this amazing physicist I worked with.
Yeah.
Walter Isaacson, who wrote the amazing biographies on Elon Musk, on Einstein and others, came to me and said, "Listen, I want to get Murray to interview you on cancer." And I go, "That'd be the coolest thing ever, right? One of the greatest physicists alive to interview me on cancer. It'd be a privilege." So we met for a couple of days prior to the interview, and he took notes. And the first thing you ask the great physicists of the world, the old time physicists, "Did you ever meet Einstein?" He goes, "Yeah, Einstein and I met a couple times, and we once went to a bar and we had a conversation. We actually argued over relativity." I'm like, "You got in a bar fight with Einstein?" He goes, "No, it wasn't a bar fight." I go, "It was an argument in a bar. So that technically is a bar fight. That's pretty cool to say." And what he would tell me was, he goes, "David, all too often in your field, you look at the average, you look at the mean. What's the average response?" He said, "Look at the outliers. Look at the people who have no response and progress like crazy, or have a dramatic response. In physics, the outliers is what taught us everything."
Mm-hmm.
And it's an amazing observation. Look in nature, the outliers on longevity. Look in the species of humans. What are the outliers? And that's one of the things that we really have learned and are starting to do. DNA, we were taught when we went to school that it was static. You're
Mm-hmm.
born with your germline genome. What we're realizing now is that it's dynamic,
Right.
that there are changes that happen in every cell that give it advantage, and that clone becomes the dominant. It's not a cancer, but it becomes the dominant clone, and then another clone will come out. And so looking at the rate of change in DNA, we started to do. And we have some data that'll coming out soon that really are intriguing, again, because of looking at the outliers. Who is the individual with almost no rate of change, and who's the one with dramatic rate of change? What induced it and caused it? Because that has impact, obviously, on things like cancer.
Right.
Cancer is amazing because, you talk about looking at evolution in nature and what we can learn from it. I get to see evolution happen every single day with cancer, right? When I treat a cancer patient, all of a sudden that cancer evolves and changes. How can I learn from that to apply it to evolution as the organism as a whole?
Mm-hmm.
Um, just like looking into nature, looking into cancer gives me a whole insight on things that are going on.
While we're on the topic of physics, one of the papers of yours that really intrigued me was this 20, I think it was 2015 paper you did with Paul Davies, entitled "Stochasticity and Determinism in Cancer Creation and Progression." And here, you go back pretty much to the very beginning of life, and sort of make the analogy. Look, cell motility and angiogenesis and hypoxia and all these unique things are not just seen in cancer, they're seen in embryos, but they're also seen, when we study, hey, what happened when the first couple, pond scum decided to get together and form multicellularity. Just say a couple words about that, because, this whole atavism concept that, hey, the somatic mutation theory, great, but we have all these examples that, these same abilities that make this cancer run wild in my system were present a couple billion years ago when life first came on the
Yeah.
scene. Just say a couple words about this paper, if you would.
So cool. I mean, Paul is an astrophysicist. So what the hell is an astrophysicist and a cancer doctor writing a paper together?
Yep.
I wanted to call up the paper, an astrophysicist and a cancer doctor walk into a bar, dot, 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 but nature wouldn't let us.
Right.
So what was really interesting is this concept of atavistic behavior, which is
Yeah.
basically going back to the beginning. Your embryonic stem cells have an atavistic behavior. They behave, like this undifferentiated, without rules. And that's what cancer really is. And so going back to the behavior of it, I think was really, a very interesting, important idea. For whatever reason, I could walk through the streets of New York City, and if I took 100 people and looked with PCR and amplified DNA, I could find BCR-able translocations in 6 or 7 of them. Yet they don't have leukemia.
Mhm.
So having a molecular change is not sufficient to have cancer. You also need an environment that is receptive and supportive, and you need the pathways to go back to this atavistic behavior that Paul describes it as. And I think that's a really intriguing way. We try to treat cancer by targeting the molecular defect, and we've made some impact, right? We certainly have improved the outcome, but it's not dramatic by any means, and we need to do better. So, actually, talking at cell communication, the cancer cells are talking to each other. One of the meetings we had here at the Institute, we brought in code breakers from totally different areas. And we said, hey, the cancer cells are talking through their proteins to each other, through the metabolites to each other. Can we interpret that conversation? Because biologists, we've never been able to interpret it. Maybe cryptographers can. And it was a really interesting meeting because I think we have to start to think differently because we're not making that same impact. It's actually kind of wild. You know, there was an amazing paper by Juan Massaguet at Sloan Kettering, where he took breast cancer cells and he divided them to half. Half he labeled green, half he labeled red. And he put the red on one side into the breast pad of a mouse and the green on the other side. And he looked 2 weeks later, half red, half green, half red, half green. So cancer is not a discrete metastasis or discrete thing. The cells go out and they come back. They go out and they come back. And we call them circulating tumor cells. And they go back to different lesions somehow. They look at their scouts. What's going on in the body? Hey, is it good to go to the bone? Is it not? And they come back and they start to talk and mix to each other. When I treat a cancer patient, almost uniformly, not always, but almost uniformly, there's a synchronous response in every metastasis. They all respond or they all progress. And that's a clue there, right? It's not just individual lesions.
Yep.
And so they're all communicating and talking. And we've never developed a treatment that blocks that communication, that tries to disrupt it. And that's a whole new way of thinking. And, getting people like Paul to start to look at the behavior of cancer, not just the molecular, profile of cancer,
Yep.
really is insightful.
Yep. Yeah, again, I've always been intrigued by as you were mentioning, the outliers, and again, some of these species that are very good at, they get cancer, but they're very good at turning it into other stuff and just, going about their day. So it's very exciting to see that paper out there and that you're thinking in all these different directions. Um, I want to ask you, going back to the jellyfish chapter for a minute, let me just preface this. I've done a couple of shows with Dr. Yang Zhao, who was formerly at DARPA Defense Sciences Office, moved on to Raytheon, doing some really crazy AI stuff. But at the time she was leaving DARPA, you only have 5 years. I asked her, what is she going on to now? Thinking quantum computing or neuromorphic. What's the next thing you want to do? And she said, no, I want to study the octopus because despite these fancy systems that we're building and our AI and all this, nothing can explain how an organism with 9 brains goes about its day and communicates amongst itself and does what it does. And it's kind of cool that you point out, the octopus sort of violates all the important things that we think about in terms of human health. It's not social. There's no octopus communities. It dies pretty quickly after, it gives birth. Say a few words about octopus. An awesome chapter as well.
I
And
saw that the documentary that won the Academy Award. I don't know if I have no sense of timing now. 2 years
My
ago, 3 years
octopus
ago,
teacher, yeah, yeah,
and it was astounding, right? I mean, it literally was an astounding thing of this creature. This creature that can regenerate a limb,
yeah.
this creature that can change its body, that has the multiple brains, all of the things that we talk about, and there's so much to think about and learn there. And then this creature, once it fulfills its function, just turns off and dies. It really is amazing. And you start to see these behaviors in animals. If an ant gets sick, the ant will leave the colony and stay there for 3 or 4 days. If it survives, it comes back in. If it doesn't, it just dies, and they don't get these communicable diseases like we do. And you don't see a whole colony die of a virus. You just see the individual ones. So, thinking about the long-term game and doing it in a conscious way, thinking about the community and doing it in a conscious way is really a powerful message that we as humans kind of forgot, right? We became very selfish. We became selfish in our behaviors, we became selfish with thinking of ourselves and not our community and others. And we need to think of a way where we can actually think broader. And obviously, COVID taught us a lot. The reason we wore a mask was to stop spread to others because that person may be immune deficient. They have a mother with cancer or they're elderly. And we have to start thinking about others and how we do things. And I think that's a very powerful message. Obviously we can't regrow an arm. Right now we don't have that capability. Maybe we could rebuild an arm, but we can't regrow an arm. Whereas an octopus, it's a little bit differently. But how does that happen? Right? How do we learn how to recapitulate that tentacle of an octopus, and how does it do it? And learning from these outliers in nature, because there aren't many creatures that can. There's some. That's going to really give us a lot of insight into biology. And the people who studied these creatures were almost outliers, right? When I talked to the ant expert, he was so excited because nobody had spent time with them. He made an observation. I said to him, he like, what was one of the greatest observations you made? He goes, it was also one of my worst days. He goes, I'm driving to see the colony that I had studied for years. And I got a call from my son, who was in his teens, who broke his leg playing soccer or football, as you call it in Europe. He was German. And he goes, I was in tears. I wasn't there for this pivotal moment in my son's life. I wasn't there to support him. I was in Africa studying an ant colony. And I didn't pay attention. And I ended up driving over my colony with my truck. And I felt horrible. He goes, but I made my biggest discovery is that when an ant is injured and three or more legs are injured, they leave them on the battlefield to die. But if it's less than three, if it's two or less legs, they bring them back. They lick the wound for 48 hours, and there's a 90 plus survival rate. It's remarkable. They and have a triage system. They know where to put resources. And obviously, there's something in the saliva that affects healing and infectious diseases, et cetera. And it was a tremendous insight. And, that basically spawned my career. So my saddest moment led to my happiest moment. It was kind of a wild observation.
Really amazing. Dave, one last thing I want to get. I know we're coming up, it's the top of the hour, and I so appreciate your time today. But there's I think there's a chapter in the section in the chapter which is entitled Touchy Feely, where you talk about themes like forest bathing and the release of happiness hormones and so forth. And I feel that way all the time when I get into nature. But I wanted to go back to something. You wrote a couple papers back in, I think it was in 2009, 2013. It was in Lancet Oncology on this theme of psycho-oncology and how different things like body image, like affect, and sort of the involvement and sort of the conversation during therapy, things like this, obviously impact outcomes. And, unfortunately, my family has been touched extensively by prostate cancer over the years. I'd just like to get your top line on sort of this general principle of psycho-oncology, sort of the mind-body connection, and any other interesting things that you're learning as you not just, are on the cutting edge of the AI world, but also are back studying nature and any important learnings that we should take away.
It's amazing, right? I mean, our brain controls everything. And in medicine, we separate the head from the body, right? The psychiatrists are in a totally different building. If I'm a doc and the patient has psychiatry, I refer them out, right? The head is separate. Where in the reality, right, the head controls everything. And we're starting to see that now, right? Things in the GI tract can control depression, can control response to immunotherapy. We're learning
Yep.
more and more the connective nature that we are this complex emergent system. We have to treat it as a whole, not by body part. And I think that's tremendously important. They had kids and they said, listen, go run around in a gym and take an aptitude test. And they saw about a 16% improvement in the aptitude test. Then they said, run outdoors in nature, the same kids, and there's almost a 24% improvement.
Yeah.
So the human brain evolved to do pattern recognition with physical activity, right? He or she who can hunt and gather and made their way back to their village survived. If you couldn't do that pattern recognition, you didn't survive. And so that's a tremendously important part of us and who we are, right? So you want to do well. So, whatever the disease, you need to get uncomfortable, challenge your brain, do that pattern recognition and physical activity, and the outcomes will be better. There's no question about it. Hope and optimism, tremendously important. People with an optimistic attitude or hope attitude or a belief system do about 30% better across all diseases in clinical trials. And we've never been able to quantify it. The NIH has a, I don't know, $30 billion budget. How much of it is spent doing, ability to quantify what's happening here in the brain? Almost none. Yet it's what controls our entire organism. And to me, that's a remarkable thing. So my job as a cancer doc is, part being therapist and part being molecular biologist and part being, a treating physician, but they all go together. And I think all too often we forget that hope and optimism part. And it's really that psycho-oncology, whatever you want to call it, is a tremendously important part that I can't quantify, but I know is real.
Mhm.
Patients of mine that are optimistic and have hope do better. It's clear. And so part of my job is not to give false hope and just to trumpet up a cure, but really give a true understanding that there is a possibility. And exercise has a tremendous role in the outcome of cancer patients, especially
Yeah.
prostate cancer. That's clearly been shown. And so all of those tie together. And again, the idea that we're a complex emergent system, the beauty is complex emergent systems almost impossible to understand, but you can control things you don't understand, right? Nobody can understand the stock market or be the richest person in the world, but you can start to control things. Monetary policy can make things go up and down. The same is true in health, and intervention can help in either direction. There's a thing called coarse graining, which originally comes from photography. I make the lens of a
Okay.
camera blurry, and all I need is the outline to know you're a human. In fact, if I had so much data, every pore, every hair, it would overwhelm my model systems. When you were sick as a child, your mother didn't draw your blood and look at your T cell activation, looked at your cytokine levels. She went like this. And this is a coarse grained element that was probably more accurate in the big scheme of things. Are you sick or not? The
Right.
climate model looks at the shape of the clouds and they can tell them in the weather rather than going up and measuring every variable.
Right.
We have to be better at coarse graining things in medicine. And psycho-oncology is one of those tremendous areas that we can start to course grain now and see what happens. You mentioned oxytocin, the love hormone.
Right.
It is a remarkable thing when you look in someone's eyes, whether it be your pet or your spouse or your friends, oxytocin goes up, blood vessels relax, blood pressure goes down, you feel better, you're more optimistic. We don't know how all of those things happen, but they're real.
That's true. I can vouch for that. Dave, anything? I mean, I could go on for a couple hours talking to you about that. I mean, it's just this fascinating body of work, fascinating journey you've been on. Final messages while we have you today pertaining to either the Institute, to things going on at USC, anything else that I missed while we have you today with you. Please kindly take the floor.
Now, listen, I'm privileged, like you, to be working in science at the present time. We're at an amazing point where technology, if it's used correctly, has the power to dramatically improve the human condition. Excuse me, and I think that's what we have to focus on now is improving the human condition and at the same time allow technology to be used correctly. I look at AI and the publications in the literature now, and I'm ashamed to say that probably 90% of them are BS. They're not real.
Mm,
So there's a lot of science that's not real going on. I mean, if you look at the data, in 10 years, 90% of science papers are proven incorrect. And there's something wrong there, right? There's a
right.
lot of stuff in the literature that just isn't right. And at the same time, there's a lot of power with technologies now to use it correctly. So I don't want restraints to come on and to make it so we can't use it for human good. But at the same time, we have to figure out a way now where we can bring the quality metrics in and mandate them so things can be done right. We're a zero fault tolerant business. If you bring in AI to manage a patient and they make mistakes, people can die. Bad
Right.
outcomes can happen. Suffering can go up. And we don't want that. But at the same time, I want everyone to benefit now from this remarkable technology. In the old days, right? I mean, the old days yesterday, 60% of people with lung cancer never have their cancer molecular characterized. We don't know if they're eligible for ALK treatment or EGFR targeted treatment. So a pill that can give them a year, 2, 3 years of quality life with their family because nobody ever looked. The beauty of AI now is we don't have to sequence the cancer that costs a tremendous amount of money and takes many weeks and has
Mhm.
been a hurdle, if you will, for doctors around the world to do. We can just look at the image of the cells and how the cells are arranged is a function of what gene is turned on. So
Yeah.
AI can instantly say, this cancer is ALK amplified, EGFR mutated, and you could treat a patient on the spot with these drugs and enable everybody to benefit from the input, the advances in cancer that are happening now. If we could just equal care across the globe, not even with any advances, we will save a tremendous amount of lives and reduce suffering. And AI can do that almost overnight if we did it correctly. So I pray that these technologies are used in the right way, that we don't put restraints on using them when we need to, and that we can really build in the quality metrics so all of us can benefit.
Excellent message. Really excellent message. It was awesome having you, David. I so appreciate your time. Again, for everybody that is going to be listening to this episode of our show across the various podcast networks or watching on the YouTube channel, you've been spending time with Dr. David Agus, Chief Executive Officer and Founding Director of the Ellison Institute of Technology, Professor of Medicine and Engineering at USC Keck School and Viterbi School of Engineering. Make sure you pick up a copy of the Book of Animal Secrets. I'll pick up a copy of all his books because he's got more than that. But really an awesome time. Really appreciate it, Dave. And again, we like to say on our show, thanks so much for helping to create a better tomorrow via all the work that you're doing for everybody out there. An awesome story.
Well, thank you for allowing me to do this and spending time with me. I appreciate it, and I appreciate your insight.
Great having you.